I'm going to speak to you about going lean, how to improve efficiency and effectiveness in the ophthalmology practice. I have no financial interest in this presentation. Well, let me first define lean. Lean is a management strategy, the essence of which is eliminating waste by understanding value through the eyes of the patient, not the doctor. We're going to talk about the value stream later, but for now, the value stream is all the steps in a process used to deliver a service to a patient. You want to deliver that value to the patient in as efficient way as you can in a continuous flow system that's built on a pull approach. And what do we mean by pull? Well, pull means that employees can pull in the next task when they are ready rather than having it pushed on them, or customers can pull from the company when they're ready for a service rather than having it pushed on them when it's convenient for the company or the practice. And we're continually pursuing perfection. We're never done. It's our job as leaders in the practice to model professional behavior. The staff looks to physicians and administrators for guidance, and our credibility as leaders depends on how others perceive us. And staff will imitate those behaviors because they form ideas about how they should act by watching those in leadership roles. The standards we set determine the practice culture, whether it's positive or negative, and lean management can create a positive set of standards for the practice by encouraging innovation, inspiring others to excel, improving quality of care, encouraging teamwork, improving access to care, and focusing on the patient. It's important for all of us to have a set of values, the core principles upon which we deliver care. And these are the values for my practice, Asheville Eye Associates. The first is integrity, next compassion, third all one team, 4 is results, and 5 is excellence, spelling out eye care because that's what we do. Lean management is consistent with our values. Our patients are in front of us because they're having a problem. What can we do in as efficient a way as possible to provide value to that patient? Lean will reduce stress for everyone, doctors, staff, and patients, and thereby improve doctor, staff, and patient satisfaction. Lean is about reducing waste, and this idea goes back to antiquity. Antiphon, a Greek orator, said the most costly outlay is time. And Sir Thomas Wilson in the 1500s said time is precious. When patients are angry in the clinic, it often has to do with long wait time, and their main concern is about how much of their own time has been wasted. We all have a finite amount of time on this planet, and it is a precious resource. Every day, 24 hours is deposited into our bank accounts, and Lean says the worst thing we can do with those hours is to waste them. The phrase time is money is often credited to Ben Franklin, one of the founding fathers of the United States. And he said in his book, Poor Richard's Almanac, he that idly loses 5 shillings worth of time loses 5 shillings and might as prudently have thrown those 5 shillings in the river. The idea that time is money can be traced back much further than Ben Franklin, however. Lean production is a formal management science that really came into being in the latter half of the 1900s when Japanese automakers used lean manufacturing to build higher quality and lower cost cars than US automakers, costing US jobs. And although new technology has the potential to decrease practice productivity, I'd like you to think about how Lean can help you add new technology and improve efficiency, and I'll show you an example of that later. Here are two lean concepts. Your day is a series of processes, and you want to reduce waste in those processes. So let's start in the morning with a process, and that's eating breakfast, which is a series of steps that adds value to me. And let's look at those steps in this process, which is the value stream. First is I open the cabinet and remove a glass, and I open a drawer and remove a spoon. And my breakfast is pretty simple. It consists of a glass of orange juice and a cup of yogurt. So I next go and I open the right side of the refrigerator and I remove the orange juice and pour it into a glass. I replace the orange juice and close the door. Then open the left side of the refrigerator and remove a cup of yogurt and close the door. Remove the lid and place it into the trash can. I take the yogurt, glass of orange juice, and spoon to the kitchen table. I turn on the television and watch the news while eating breakfast. And then I throw out the trash and wash the glass and spoon. Well, what if the orange juice and yogurt were on the same side of the refrigerator? You'll see later that this represents a waste of motion, having to open each side of the refrigerator. So think about your surgery and your technique and how the best surgeons eliminate all wasted motion. There are 8 types of waste that you will need to learn. And once you learn them, you will see them all around you. You can use the mnemonic Downtime to help remember the 8 wastes. Starting at the top, D is for defects, 2 is overproduction, 3 is waiting, 4 is not utilizing talent, 5 is transportation, 6 is inventory, 7 is motion, and 8 is excess processing. So make sure to learn each of these types of waste and you'll see it all around you. Downtime. So if we look at workflow, there's invariably some waste involved, and that makes the workflow long and unpredictable. So we can shorten a clinic visit or surgery by eliminating waste as much as we can and making the time more predictable and the results more predictable. Work smarter. So let's go through these wastes one by one, starting with the D and downtime. D is for defects. So this is a service which the customer would deem unacceptable to pass the quality standard. Defects reduce or discourage customer service. And so this service or product with a defect is going to require rework. What are some examples from an ophthalmology clinic? Well, first would be optical, incorrect prescriptions. For whatever reason, the patient comes back unhappy with their glasses, and it takes time to go through to figure out what's wrong with the prescription. And of course, the patient's frustrated with the extra work of having to return to the clinic. Wrong site surgery. Well, this is a serious example of a defect. And then finally, history documentation. Let's say that the history is taken incorrectly by the technician and the doctor has to repeat it. Well, that's a defect that has to be corrected. The next waste is overproduction. So that's producing too much of something, more than is required, or too early. So here station A is producing more than station B can process. And we'll see an example of that in clinic flow in just a moment. So overproduction, here are some examples. Overbooking for no-shows. So when you're overbooking, someone's having to do extra work to schedule the appointment, contact the patient about the missed appointment, and then reschedule the appointment. So a goal here would be to develop strategies to reduce no-shows, providing more instruments or supplies than necessary in the operating room is waste, and then uneven loads in the clinic, which we'll talk about next. So this is often a scenario that we see in the clinic. There are 5 employees in this clinic, employees A, B, C, D, and E. And you can see by 10:30 in the morning that resource D is busy and behind schedule, while resources A, B, C, and E are free. They may be just standing around. And who do you think employee D is? Well, that's the physician. So there's uneven workflow here where too much has been produced and too early for the physician to handle. And so the physician's backed up with patients at that point. There's a bottleneck, and that causes increased wait times for patients. So the staff is overproduced for the physician at this point in the morning. Well, the lean ideal is that all resources are equally busy during the day and they're cross-trained to help each other as necessary. So you can see now at this time of the day, every employee is busy doing something and flow is much better and wait times are reduced. The next waste is waiting. And this is waiting for a work cycle or service to be completed or to begin. And there's all types of waiting that goes on in the office. You can have the patient, staff, or physician waiting. They could be waiting for an appointment. They could be waiting on hold to get an appointment. They could be waiting to be called to an exam room, or waiting in the exam room, or waiting for an open exam room. The doctor or staff could be waiting for patients to arrive. The staff could be waiting for a late doctor to arrive. The doctor could be waiting for technicians to work up patients, or you could be waiting for medical records and test results that you need to complete the exam. So waiting, no matter where it occurs, no matter who's waiting, is waste. The next waste is not utilizing talent. So that's not utilizing employees' knowledge, skills, and abilities to the fullest. And in my clinic, and possibly in yours, you utilize orthoptists to help make the most use of talent so that the doctor can be as efficient as possible. So here's some examples of utilizing employees to their fullest. I have staff manage my correspondence. So in addition to pediatric ophthalmology and strabismus, I also practice neuro-ophthalmology and order a lot of tests and scans or consultations with other doctors and correspondence from referring doctors. And so I have my staff help me manage that correspondence and get it entered into the electronic health record. As I mentioned, I utilize an orthoptist to assess the alignment and manage patients with amblyopia and strabismus to help free up my time, having technicians help with refractions, and really soliciting any of your frontline employees to get their suggestions to improve efficiency. So utilize all your employees to make workflow better. The next waste is transportation. That's the unnecessary movement of anything or anyone between processes. And here's a technician escorting a patient to the checkout desk. We'll talk about that process in a moment. So transportation, the unnecessary movement of anything or anyone between processes. So that might involve transportation of the patient from the tech workup room or waiting room to a physician exam room, transportation of patient charts from medical records room to clinics, doctor's offices, and so forth, sharing equipment, so having to walk from one clinic to another to borrow an autorefractor or lensometer. And then we showed a picture of transporting patients to the checkout desk where they used to have to go to get their appointments made or have billing performed with their insurance company. And the next waste is inventory. So inventory is service, work in progress, supplies, equipment, or finished goods, which does not have value added to them. And that might include an excess inventory of anti-VEGF medications or Botox, both of which are very expensive. optical or contact lens inventory. You want to make sure you have good turnover of your supplies. And just looking through your cabinets or drawers to look at items that are never used. And then motion, that's the unnecessary movement of people. And sometimes it can be very helpful to map out the steps a patient or staff takes in managing patient flow and helping you improve it and reduce the number of steps. So motion of people and individuals is what we're referring to with motion. So how can you shorten the number of steps that you and your patients have to take? Maybe if you're counting steps for exercise, this is good, but too many steps does not make for a lean practice. So here are some examples of movement. So looking for paper charts that might be missing, locating equipment that might be in far reaches of the clinic and require multiple steps to reach it, having lanes standardized so that every time a doctor moves from one clinic to the other, the equipment is in the same place in each drawer, and he or she doesn't have to look through different drawers to find that equipment. And then having your reference material in proximity. So if you're looking up drug information, having the app Hippocrates on your phone is very helpful to save you steps. And when you have a lean mindset, you see waste everywhere around you, and where lean implementation's been utilized. And this is a lean airport in Dallas, and I could see right away when I was in this airport that it was very different from any airport I'd been in, and that someone with lean thinking had designed this new facility. So at this airport, you go to the check-in counter, which is on the left, and then you get screened and walk immediately across the hall to your gate. And when you arrive, you go directly across the hall to baggage claim, which is right next to the check-in counter here. And then after you get your bags, you go straight out the door to ground transportation. I've never been in a large airport like this one in Dallas, Texas, and think about how many steps you take in a typical airport to go from check-in to the gate and from the gate to baggage claim and ground transportation. The next waste, excess processing. So after the transition to electronic health records, some doctors would print the exams and keep a paper chart for years after the electronic health record was implemented. So having two charts is wasteful and expensive and results in extra printing costs and time to store and retrieve the paper charts when the record is already available on the computer. So excess processing is processing beyond the standard required by the customer or patient. The patient only needs one medical record. And here's some other examples of excess processing. By improving processing efficiency and eliminating excess processing, we ultimately use less resources to achieve the same customer or patient service. So we talked about keeping paper charts along with the electronic chart, opening exams on computers outside, and then opening them again inside the room with the patient, repeating refractions due to lack of training. And in this case, the optician rechecking the spectacle prescription once received from the lab, when the lab making the lenses already has someone doing the same thing. That's excess processing. So remember the 8 categories of waste. Remember the mnemonic downtime, standing for defects, overproduction, waiting, not utilizing talent, transportation, inventory, motion, and excess processing. Once you learn these categories, you'll begin to see waste all around you. Well, I'm going to show you a short case study presentation about the lean implementation of electronic health records. I want to use this example because there have been many complaints as physicians transferred to electronic health records, but I want to show you how to think of new technology and how to create an opportunity to eliminate waste. And I want to show you that the savings could be substantial if you do this. So Asheville Associates is a 22 provider practice, which is headquartered in Asheville, North Carolina, with a total of 9 offices in Western North Carolina and over 200 employees. And this is a process map for a patient visit, and I've shown you how to lay it out step by step. I've divided it into a blue pre-visit category, and then green rectangles and red triangles during the visit. The rectangles are when something of value is happening to the patient. This is something the patient actually values. They're making an appointment. They're checking in, they're seeing a technician, they're getting a test, they're seeing the doctor. The red is the non-value added activity, and that's all the waiting that occurs. And I think you might be surprised if you build a process map like this about what percentage of time your patients spend in the clinic is value added time and what is waiting time or time they'd consider to be wasted. And what's the number one complaint in most doctors' offices? It is waiting. So I'm going to share with you some changes we made to both shorten the patient's time in the clinic and save on costs without impacting the time the doctor spent with the patient. Whenever we tackle a process improvement project, we get everyone involved in the room together. Lean involves getting those involved on the front lines. And I'm going to show you an example in a moment where we made just 2 changes, one in the check-in process and one in the checkout process. Did not affect the time the doctor spent with the patient at all, but making these 2 changes eliminated waste in each of the 8 lean categories we discussed. Now, your process may not work exactly like the value stream map I've shown here. Each of you needs to map your own process, whether it's in the clinic or in the surgery. There are many, many processes in a physician's practice or in a hospital. And this is how we actually do value stream mapping in the office. When we do this, we get everyone involved, including those on the front lines with this process. And you can use sticky notes like this to map your process, provide estimates of the time for each step, or you can formally time it. And you can estimate waiting times for each step, or again, you can formally time it. The idea is to get everyone involved in the process to come up with ideas of where they see waste in the system and where improvements can be made. When we went to electronic health records, we were able to move to a centralized scheduling for all 9 offices rather than have patients call in to each office separately. This eliminated personnel in each office, as those in centralized scheduling could see every patient's chart and every doctor's schedule. And electronic health records and voice recognition software has made dramatic changes in the time required to complete records and how quickly referring doctors can get the results of your consultation. The old process on the left involved dictating onto tapes at the end of the day, or often at home, as there was not time to do this during the day, and then putting those tapes after they were dictated into a little basket like this, which would be on the doctor's desk. This transcriptionist in the lower left would then walk around the office multiple times each day and pick up the doctor's tapes. She would then transcribe them and would then put them on the doctor's desk to sign, where they would then go back down to the transcriptionist and she would mail them. The entire process could take a week and involve much time after hours to complete this process. Now on the right, our new process with electronic health records, we use Scribes to help document the exam during the visit, and then the doctor dictates the impression and plan using voice recognition software. The records are completed immediately at the end of the exam, and they're faxed immediately to the referring doctor's office, who has it within minutes of the exam being completed. So this shortens by likely a week or so the time it takes to get a chart completed, and eliminates all of the time that used to be spent after the clinic, after hours, to get these charts completed. And I did mention that we utilize Scribes in our office. We use them to help record the exam while the doctor is examining the patient. We talked about our process of escorting patients to checkout to schedule their follow-up appointments and do the billing to handle the insurance for the examination. Now the scribe does all this in the exam room, and the patient can leave immediately after the exam. So we no longer have a staff member escorting the patient to checkout. That saves their time, and we no longer waste the patient's time in a checkout line. This is much more efficient. There's less waiting and less personnel required, and we've virtually eliminated the checkout desk. Well, let's look at an example of what happened when we made a change in a process and the impact it had on waste and time and money. This process may not apply to your hospital or clinic, but I want to show you an example of how only 2 changes to a process can have a tremendous impact on waste. We had the front desk collect the portion of the bill, which was the patient's responsibility, and had the scribe post the charges and schedule the follow-up appointment rather than having the patient go to a checkout desk for both billing and appointment scheduling. We were then able to eliminate waste from each of the 8 categories by just these 2 changes. And note, we didn't do anything to impact the time that the doctor spent with the patient. So we reduced the waste of transportation because we're no longer transporting the patients or charts to the checkout desk. And there's no transporting the encounter forms necessary for billing or appointment scheduling from the checkout desk to the billing department downstairs. There's also decreased motion of staff and patients from these changes. There's no longer the filling out of an encounter form with the charges and then having the billing department reopen the exam a couple of days later and post the charges. Instead, it is done once by the scribe. We also reduced overproduction. We get the charges posted one at a time rather than have an employee bring hundreds of charge sheets down at once to pull on the biller's desk. And there was no waiting for charges to get posted. We were fully utilizing the staff to make the most use of the scribe's time. There's no longer any waiting at the checkout desk for an appointment or to pay a bill. And there's no inventory of encounter forms. The waste of time filling these and waste of the room space is gone, as seen in the slide on the right. Again, the process in your clinic may not work like this. This is only an example of how to think about new technology and how you can be more efficient by making just a few changes in your process and getting ideas from people on the front lines, like you see here, about how to make the process more efficient. Well, many doctors complained about the transition from paper charts to electronic health records, but we were able to show that by implementing new technology in a lean fashion, that we're able to save considerably on staffing costs, amounting to over $500,000 annually by the 5th year of implementation. And some of these staff were retrained to do other jobs that were more valuable to us in the practice. What can you do in your office to make it more efficient? We published our results in the journal Ophthalmology in 2016, showing the considerable savings that could be accomplished by lean thinking in the implementation of electronic health records. Well, the bottom line is that you can use lean thinking to map your processes and re-engineer them by finding ways to eliminate waste. New technologies create opportunities to reimagine processes, and lean management is a leadership strategy which can create a professional and positive culture in your practice and keep your patients and other customers' best interests in mind.